Hello, and welcome back to Helpful Tips for Healthy Aging. My name is Sam, and I'm a health promotion major at the University of Georgia. In this video, we will discuss managing your medications. Medications are a way to lessen the consequences of disease and to slow its course. They typically serve one of the following functions: to relieve symptoms, to prevent further problems, to improve or slow the progress of disease, and to replace substances that the body is no longer producing adequately. Even if you are not seeing day-to-day improvements, it's important to continue taking your medications as instructed by your doctor.
While medications are aimed to change the balances of chemicals in the body, it is reliant on your beliefs and expectations as well. An example of this is the power of the placebo. This is when you are taking a pill without any medication in it, yet you still feel an improvement in your health. The placebo effect shows how your beliefs and expectations can initiate your self-healing processes. It's important to remember to always be positive when taking your medication so you can have the best outcome possible. Here are some ways to look at taking medication in a positive light. Examine your beliefs about the treatment. Having a negative mindset about your medication can undermine its effectiveness. Reframe your attitudes towards taking medication. Thinking of medication as taking vitamins can help you to see it as a healthy habit rather than a chore. Imagine how medicine is helping you. Developing a mental image of how the treatment is working in your body can allow you to stay positive about the treatment process. Keep in mind why you are taking the medication. While there can be negative side effects from taking the medication, such as hair loss from receiving chemotherapy, these effects can be proof that the medicine is taking its course.
It is often common that people who struggle with one condition struggle with others. This can lead to having to take multiple medications at one time. Taking multiple medications involves dynamic communication between the doctor and yourself. Taking the fewest medications and the lowest effective doses for the shortest period of time are the goals of treatment. This can only be achieved by effective communication with your healthcare provider.
Here are some questions to consider when discussing your medications and help with your healthcare provider. Ask yourself, are you taking any other medications? Have you had allergic or unusual reactions to any medications? What are your chronic diseases and other medical conditions? And what medications were tried in the past to treat your disease? While it is important to inform your doctor of your health status, it is also crucial to ask the following questions. Do I really need this medication? What is the name of the medication and dosage that I will take? What is the medication supposed to do? How and when do I take the medication, and for how long? What foods, drinks, and other medications or activities should I avoid while taking this medication? What are the most common side effects, and what should I do if they occur? Are there any tests necessary to monitor the use of this medication? Can a less expensive alternative or generic medication be prescribed? Is there any written information about the medication?
Here are some things to note on your prescription label: your prescribing physician, the directions for taking medication, the name for medication, quantity of medication in the package, number of remaining refills, expiration date, dosage per tablet, date filled, and the special precautions or warnings about taking the medication. A label will also include your name. It is important to take the medication prescribed to you by your doctor. If you struggle to remember to take your medication, here are a few helpful tips. Give yourself reminders. placing the medication in obvious locations, leave yourself note reminders, use apps on your phone. You can also utilize checklists or organizers to make sure you are remembering to take the correct medication at the correct time.
While it may be tempting to indulge in alcohol and recreational drug use, these behaviors can worsen your chronic condition. Consider limiting your consumption as well as practicing honesty with your healthcare provider. Medications can often negatively interact with illicit substances, so it is important to have open communication with your physician in order to protect your health.
Over-the-counter medications can be effective in treating everyday symptoms alongside your prescribed medications, and may even be recommended by your doctor. However, before you self-medicate, remember to consult your physician or pharmacist to make sure that it is safe to take alongside your other prescriptions. We hope you have found this information on managing your medications helpful. For more content like this, like Northeast Georgia Health Matters on Facebook. Thank you for watching and have a great day.